Okay, haven't done one of these in a while, but figured it might be good since we've had a post-holiday jump in COVID cases to visit with our doctors, and we get two for the price of one today. This is one of our briefings, incidentally, on KLAM and KCDB. Brought to you as a public service, and when they're needed, they're in the 1 p.m., 5 p.m., and 8 p.m. hours on the radio. This will also go to our YouTube channel, Cordova TV, youtube.com/Cordova TV, as soon as we can get it uploaded there. Dr. Gloe and Dr. Sanders are with us from CCMC, and again, we're going to look at what the spike means and what do we do about it? Do we do anything about it? And just kind of a status check on things. So that's what's up next here. So, Dr. Gloe, we'll start with you here. There's been obviously a jump in cases. Yesterday it was 30-something. Today it's actually down a fair amount to 20-something. So what is this number, having cases in the 20s and 30s, is that an area of concern, or is that just, hey, another day in the ebb and flow of the pandemic?
Right. Well, I think it just makes sense with this Omicron variant and the holiday travel that we're going to have this increase in cases. And I suspect that the cases are going to go up even from here. The good news is that, and we're seeing that pattern throughout the country and throughout Alaska, that the numbers are definitely increasing, but we're not seeing the rates of severe illness increasing.
Yeah, I've noticed that too. Staggering increases in case count, but not even close to corresponding, even when you go, with the lag of 2 weeks or a month or whatever it typically is, the big jump in hospitalizations and fatalities. While the case number curve shoots way up, the other one stays relatively flat, is what it's sounding like. Are we also seeing that in Alaska?
Yeah, we absolutely are. It's definitely, it's concerning that there's continuing cases, but at the same time, I personally, as a physician, feel like I'm taking a bit of a breath and saying, great, our hospitals are not overloaded. We're able to make transfers to facilities because they're not overburdened. So it's just seeming so far that this particular variant, which I suspect is the dominant variant in Cordova right now, is just not as severe.
Okay. And again, that's the way it is across much of the country. And in many ways, this, all of these numbers and all of these conversations about the spread of coronavirus are very different than what we were doing a year or 2 years ago, even however long it's been that we've been doing this. I noticed in the latest press release from the city, Dr. Sanders, that the city has opted to not maintain its own alert level, which I found kind of interesting, actually, because if a lot of maybe what's driving hospital overload or spread or, just the things that keep that R naught metric, how many people are transferring it to how many other people, how transmissible it is. We've sort of maintained our own. We've had our finger on our own pulse in that return. So do you know why the decision for Cordova to just follow the state's alert level, how that came about?
Yeah, thanks. That's a good question, and certainly has come up a lot in the community. I think when we developed the health advisory plan, it was in March of 2020. And as we worked and refined that over the course of the pandemic, the plan hasn't necessarily been revised over the last 6 months to even year. As we have gone along the pandemic timeline, we have vaccine, we have some treatment options, and we understand what we're up against a lot better. So a lot of the language in that health advisory plan still has things like hunker down, which can be very alarming to the local residents when they see those advisories going out. So that was part of the push from the medical response team to say, let's follow the state. The state has epidemiologists, they have experts that are providing that guidance to us in terms of what our response needs to be. And so our advice was that locally, we really can follow the state's guidance on this. And that plan that we developed a year and a half ago, 2 years ago, is a little outdated. And so we felt like it was time to stop pushing that information and go with the known information from the experts in our state and CDC.
Okay. Yeah, well, and I mean, if an interim step isn't essential in terms of keeping our community properly informed, then why not streamline it? You know, that certainly makes sense. As far as mitigation measures now, again, the between yesterday, which was Thursday, and today, which is Friday the 14th, the case count dropped by 10. Dr. Gloe indicated we could see it swing back up again because Omicron is very contagious, although, again, not nearly as risky a disease to get. But have things changed in the way of mitigation, or is it kind of all the same stuff, Dr. Gloe? I mean, how do we, if we want to reduce spread, how do we go about doing it?
Right. Well, unfortunately, over the last 2 years, we've learned a lot about how to prevent the spread of disease. I guess, fortunately and unfortunately, because we're all getting quite tired of it. But it's still a lot of the same things. It's washing your hands if somebody is sick, to try to prevent going out into public spaces where they might be coughing or spreading germs. Masks can be helpful in some situations, but it's also reasonable for businesses to make the choice that masking is not required to enter their facility. So, but, I think we're going to see a lot of information, hopefully, over the next few weeks or so about how virulent this variant is. And virulent means how dangerous really this is.
Right.
And then we'll be able to really reassess what level of mitigation we still need to have for this.
Yeah, well, and again, the data from some of the other countries that got hit with Omicron before us, South Africa especially, and later Britain, indicated that it goes up a while and then it comes back down. But again, the severity of illness, any case where it becomes severe is obviously tragic. You don't want to see that happen. But overall, the severity of illness seems to be down considerably, which doesn't mean, okay, let's all run around and lick each other and not worry about anything. I mean, people need to still take their precautions as they see fit. But it sounds kind of like, there's going to be an ongoing evaluation process, and maybe in a few weeks or a month or something on down the road, we'll have a quick chat again about what's been learned.
Yeah, that sounds great.
All right, good. Well, anything else from either of you in terms of follow-up, or have we basically covered it?
I think we covered it. I will just add, I think everybody right now is cautiously watching the schools. Everybody's goal is to keep the schools open, and continuing these layers and testing will help us to prevent all of the staff from being sick at the same time, even if it is a less severe illness. If many people are sick, it will be hard to keep the school doors open. So everybody, please stay home when you're sick. If you get a test at home, we still recommend you come in. If you get a positive test at home, that you come into the hospital to confirm that test. And then those numbers, that is how the numbers also get counted in the state records for the COVID cases. So if you do get a positive test at home, come into either Elanco or CCMC to confirm the test.
And you guys are still vaccinating at both facilities too?
Yes, yeah. Every week we are. Sorry to interrupt you, Paul, but every single week we're doing vaccines and boosters.
Okay, and is it still all three types, or I haven't followed if J&J's fallen out of favor recently or not, but it's what are the different vaccines that are being offered now?
Yes, all three vaccines are available.
Okay, good. So people have still got those options, and if you like the one that Aunt Myrtle got and she didn't have a bad reaction and you want to pick that one, then by golly, do what Aunt Myrtle did. Thank you very much, doctors, for the time. It's always nice to get knowledge from the people who have it, and we'll see if we need to visit again, even if it's maybe just to share some good news later on down the road. But I appreciate you being on with us.
Thank you.
Yeah, you bet. Yeah, thanks.
All right, Dr. Gloe, Dr. Sanders, we thank them both for their time. Remind you again, COVID-19.cityofcordova.net has the latest numbers and a variety of resources available for Cordova's pandemic prevention information. And also that Cordova Prepared Facebook page is a good one if you're a Facebook user. Just search Cordova Prepared and a lot of the announcements come out there. And I saw actually there was one announcement that came out that actually got pulled and revised. So if you saw that that sort of downloadable full page announcement, it might be worth going back and taking another look because the city has modified its communication on that. So the one again that's the most recent, it's sort of a question and answer post at the Cordova Prepared Facebook page. I'm J.R. Lewis on the Clam and the Eagle. Thanks for listening in, and we'll get you back to regular programming.